Discussing peripheral vascular disease is Heart Center cardiologist Dr. Michael Yen. Dr. Yen, what is peripheral vascular disease?
Peripheral vascular disease is atherosclerosis of other vascular beds outside of the heart. It usually involves the arteries of the neck, sometimes of the legs, sometimes of the mesenteric vessels, which are the stomach vessels, or vessels to the intestines, also sometimes to the vessels to the kidney arteries. We usually test for these blockages with non-invasive tests first, prior to considering more invasive tests.
How is peripheral vascular disease diagnosed?
Peripheral vascular disease usually is first diagnosed with history. Usually a patient, if they have blockages of the legs, will tell you that they have pain with walking that gets better after they rest. And sometimes what we do after that then is we do what we call an arterial brachial index test, which tests blood pressures in the legs as well as in the arms, and we have them walk on a treadmill if they can for a few minutes, and then we measure the pressures after exercise. And if we see diminished waveforms or decreased pressure waveforms on those tests, it usually diagnoses peripheral vascular disease, and we will move on to more invasive tests. For the neck arteries or carotid atherosclerosis, we usually use ultrasound as a test for that first. Generally speaking, we do a physical exam. If we hear a bruit, which is an abnormal thrill that we hear in the neck, then we order an ultrasound. If a patient's had concerning symptoms, let's say they passed out or they have a lot of dizziness or they can't walk very well or any signs of stroke or what we call transient ischemic attacks, then generally we order a carotid ultrasound to screen for disease of the neck. For the kidney artery, that's a little bit more difficult to try to ascertain whether or not someone has significant blockage or not. Usually we reserve these tests for patients with very poorly controlled hypertension or kidney function that's very poorly controlled over the last few months to years. Then we can do an arterial ultrasound first and then move on with other tests after that. Once those preliminary tests are done, and we usually try to prefer non-invasive tests first, we move on to more invasive tests to get a better understanding of where the disease is, how badly blocked it is, and how to treat it. And that would usually be some sort of scan, such as a CT scan with contrast, which can look at both the carotid arteries. You can also evaluate the arteries to the neck as well as to the kidney arteries and mesenteric arteries, the arteries to the bowel or the stomach, and also we can also look at the arteries to the legs with that test.
What are the symptoms of peripheral vascular disease?
Peripheral vascular disease is usually underrecognized and underdiagnosed, and that's why we as the Heart Center try to focus on this when we see our patients. We don't want to concentrate not only on the heart but on other vascular beds. First off, regarding peripheral vascular disease of the legs, generally speaking, history is very important for that. A lot of times patients will come in complaining of hip pain or knee pain or leg pain for many, many years and have been told that it was joint pain or arthritis or something, a neuropathy of some sort, where actually it may be in some cases peripheral vascular disease. So by history it's very important, trying to determine whether or not they truly have symptoms of peripheral vascular disease or not. And then with physical exam we can try to pick up pulses, diminished pulses, any redness, any non-healing ulcers of the legs, something to also give us evidence that there might be peripheral vascular disease present. For the neck arteries, for the carotid arteries, like we discussed previously, for carotid disease, generally speaking, history is very important as well. If patients have had a history of fainting, dizziness, can't walk well, any history of stroke or prior transient ischemic attack or mini stroke, we would be concerned that there possibly could be disease of the neck arteries that could cause this. Generally speaking, on physical exam, we'll want to try to pick up any diminished carotid pulses or any evidence of a bruit, which is a thrill that we usually hear with the stethoscope. I think in those patients then we'll get a carotid ultrasound to further go on, and if that is positive for significant carotid atherosclerosis, we move on to more invasive studies such as CT angiography, MR angiography, or conventional angiography. For the kidney arteries or mesenteric ischemia, history is also very important. A history of poorly controlled blood pressure over the last few months to years, previously well controlled on medications, is one risk factor for kidney, or one component that we're concerned about possible renal artery stenosis or kidney blockage. Sometimes worsening kidney function over time, despite medication, and well-treated hypertension is another indication. Or if you've had evidence of evidence of pulmonary edema, which is actually fluid buildup in the lungs out of sudden onset of no clear etiology. In other words, not a related to a heart attack or a weak heart, that's sometimes indicated that it could be kidney artery blockage causing that, and we usually get an ultrasound first. If that is positive for possible kidney blockage, we move on to more invasive studies such as CT angiography, which is a CT scan with contrast, or conventional peripheral angiography, which is done in the hospital, where we use a catheter to engage the arteries and subsequently use dye to visualize the arteries.